Good morning, good afternoon, and good evening, and a special welcome to those joining us live from 60 countries around the globe. My name is Zorica Trikic. I'm a Senior Program Manager in ESA, and I'd like to welcome you to the 8th webinar produced by the Early Childhood Workforce Initiative. The webinar focused on a new home visiting workforce need assessment tool. The Early Childhood Workforce Initiative is hosted by ESA, International Step-by-Step Association, and Results for Development, R4D, and its activities, including this webinar, are made possible by the financial support of the Bernard van Leer Foundation, the Elma Foundation, and the Open Society Foundation. Today, I have a pleasure to moderate this webinar. While in the previous period, I had the privilege to participate in the process of developing and piloting the tool. This webinar will be recorded and all registrants will receive the recording. It will also be publicly available on ESA's YouTube channel and on the initiative's website. You can also, in the panel on your right side, find some handouts that you can download. As you could see in the announcement of the webinar, we will today focus on presentation of the tool, and we will try to explain and illustrate the process of its piloting. The rest of the webinar will be reserved for your questions, and we will try to provide as many answers as we can because we only have 80 minutes. We already collected some questions in advance, so we will at the end start from there. Next slide. Today with me are my dear colleagues, friends, and people, professionals that I admire. Kavita Hatipolu, she is a program officer, Global Education Team is in Results for Development from US. Dr. Elizabeth Omondi, Reproductive, Maternal, Newborn, Child and Adolescent Health, Coordinator and Early Childhood Development Focal Person in Siaya County in Kenya. And Vera Rangelova, can you put slide back? Vera Rangelova, Early Childhood Development Officer from UNICEF Bulgaria. So I would like to start with Kavita, and I would like to ask Kavita to present to us the Early Childhood Workforce Initiative, the tool, and the piloting process. Kavita, can you?
Sure. Hi, thank you, Zorica.
Welcome, Kavita.
Thank you so much. Great. Well, as Zorica mentioned, I'm Kavita Hatipolu, Program Officer here at R4D, and I have the pleasure of telling you a little bit more about the Early Childhood Workforce Initiative and the Home Visiting Workforce Needs Assessment tool that we have recently developed and piloted. So first, I just wanted to give a little bit of background about the framework for ECWI. ECWI is a global, could we go back a slide? The Early Childhood Workforce Initiative is a global multi-stakeholder effort to promote high-quality, equitable early childhood services. And we really do that through a focus on those who work with families and young children, as well as those who supervise and mentor practitioners. In doing so, we seek to strengthen the global knowledge and evidence base, as well as build country capacity for workforce planning and development. And that's really where this tool comes in. So some of the activities that we do are around knowledge creation, joint learning, dissemination, and as I mentioned, with the goal of ensuring that the workforce is prepared, supported, and empowered to be able to provide young children and family with quality services. In this current phase of work, some of the activities that we've been conducting include a series of global key informant interviews across 15 countries to better understand what are the priorities of countries, and as well as some of the approaches that they are taking to supporting the workforce. And those resulted in 6 country briefs, which are available on the website, and hopefully you get a chance to look at those. But it really also helped us better understand what are the country's needs and interests around a diagnostic or some sort of tool to look more closely at the workforce. And so, as I mentioned, we in this phase developed the tool. And so now I'll turn over a little bit more concretely to the needs assessment tool. Next slide, please. And next one. Excellent. Thank you. So the home visiting workforce needs assessment tool was really a core focus and a wonderful tool that has been developed over the past 18 to 20 months with the support here of colleagues at R4D, ISSA, as well as being heavily supported and inspired by UNICEF's pre-primary diagnostic tool. So the scope really is on the supporting personnel, the personnel supporting home visiting programs, really focusing on those kind of programs that focus on pregnant mothers and caregivers with children across under age 3. And the tool can be applied across sectors and recognizing that many of these home visiting programs are also delivered across sectors. Part of the rationale for developing such a tool is we do see the increased focus on supporting parents and children, particularly in the first 1,000 days, as well as additional global efforts with the implementation of the nurturing care framework, as well as I mentioned, the opportunity by developing this tool to complement existing tools and resources. For example, UNICEF's tool focuses on more pre-primary, and this was an opportunity to look a little bit more closely at the 0 to 3 population and programs delivering services through home visits. Next slide, please. Great. So the objectives of the tool were to support policymakers and relevant stakeholders to review, analyze, and reflect on the current status of programs that they were delivering, and the workforce particularly that was supporting them and delivering these services. Looking a little bit more closely to identify what are some of these workforce gaps as well as issues, improve knowledge and exchange across diverse sectors and actors, as I mentioned, not only in the early childhood workforce, but particularly in home visiting. You're talking about a lot of different sectors and the need to really work together, communicate and collaborate. And we saw this as an opportunity to bring a diverse set of partners together. And then as well as ultimately prioritize areas for attention. So this could be at the government level, the national, subnational, wherever the program is in operation, and taking into consideration sort of feasibility and potential for impact. Next slide, please. Just briefly, as we started to look at the development of this tool, we were also thinking about what international research tells us about effective home visiting programs. So we know, as I mentioned, home visiting programs can vary widely in scope between universal programs as well as those who focus more concretely on parents with vulnerabilities or young children and who may not have access to other services. They can be delivered across some different modalities, including in the home visits, as well as in group sessions or seeking to foster peer-to-peer support. They can also range, we see them across countries, small pilots all the way up to national programs, for example, Brazil's Criança Feliz. And they leverage different types of workforces. So some build off of existing platforms and workers, such as community health workers, and some seek to utilize more specific cadres of the workforce. And as we see here, the effective features, there's no single silver bullet, but we do see overall that greater frequency of visits and longer duration of services is positive. We're really talking about the quality of interaction and the relationship that gets built between the home visitor and the family member. And the opportunity to practice activities together, the ability to tailor content to meet the needs and interests of families served, and the opportunity for ongoing support and reflective supervision. And really, many of these are related to the personnel that are delivering these services and how they are supported and empowered to deliver on these services. Next slide, please. Again, as we sought to develop this tool, we developed a conceptual framework, and that included some of the methods, including looking at the literature that is on parenting and home visiting programs, particularly in low and middle income countries, looking at existing workforce tools from the health and education sectors, as well as the consultations with global regional experts. And then part of what we're looking forward to here today is hearing from stakeholders in pilot countries. But you'll see this is the overall look of the tool, has these 7 different areas. And I'll go into those a little bit more in depth right now. Next slide. Great. So really, we designed this tool. First off, I want to talk about these sort of what we're calling these yellow areas, these aspects that are really close to the everyday work of the home visitor. So these include workforce expectations, looking at job descriptions and profiles, competency standards, how people are recruited and assessed at the time of hiring. Then going on to curricula, materials, and resources. Again, looking at what are the information that people have to deliver their jobs, what are the screening and assessment tools that they have, how are they provided with play materials or other materials that they use in these home visits. And then looking at, I see it got cut off here maybe a little bit, training, supervision, and career development. Looking at what are the opportunities both before as well as while people are serving in home visiting roles, to better learn and understand about their craft. Opportunities for supervision and mentoring, for peer support, and the opportunities for continued professional development and advancement within the field. And then fourth on this page is working conditions. What is their workload, pay, both in amount and means of delivery? What are some of the incentives, both monetary and non-monetary? The organizational culture, community safety, and transportation. So those are the areas that really on a day-to-day basis we find have a really direct impact on the home visitor's ability to deliver their services. Next slide, please. All right, so then moving out at a sort of more systematic and systems level approach, we take a look at these 3 blue areas, the first of which being program design. So looking at elements, as I mentioned, about duration, the frequency, who is being served, making sure that who you're serving and the ways in which you're serving is related to the objectives that you want to and the outcomes you want to achieve, the content and the modality. Enabling environment covers aspects of program governance and finance. What is the overall environment and support buy-in for home visiting programs? What are some of the rules and regulations around the workforce and the coordination across sectors and services, as well as leadership of the program? And then finally here, we have monitoring and quality assurance. So how is the data being collected? How is it being used and used to inform program improvements? What are the program standards and guidelines? And how is performance monitored across the program and services? Thanks. So that's the overall, those are the 7 different tool areas. The basic structure of the tool, each of these areas is composed of a series of goals, measures, and reflection questions. This doesn't lend itself that well to a slide or to description, to verbal description, but hopefully I'll make this clear for you. Within each area, as I mentioned, there are a series of, actually if you could go back quickly. there are a series of, let's say, like 3 or 4 goals, each of which have a series of measures, and then each of which have another set of reflection questions. So on this slide, you can actually see a snapshot of how one, this is area 3, training, supervision, and career development, how the tool itself is organized. So at the bottom here, in the smaller type font, these are the reflection questions. So these are the kinds of things once you bring practitioners and stakeholders together to say, all right, so do we have these in-service training opportunities available? Are they accessible to all home visitors? And what does that mean to be accessible? And are they responsive to and reflective of the roles and the responsibilities of the home visitors? Do the topics, are they relevant to the day-to-day roles and services that the home visitor carries out? And those are the kind of questions that feed into this measure. So training, as I said, is widely available and accessible, focuses on the skills and the knowledge and skills most relevant for the day-to-day home visitors, which is all situated under this broader goal. So the idea is, you can look at your system across a number of levels here. And really within these tool pilots, we've been focusing sort of at the measure level. That seems to be a little bit like the sweet spot for where we're sort of collecting and reflecting information back for the countries. Next slide, please. Great. So following the development of the tool, we really sought to identify countries and sites in which to pilot the tool to really understand how is this applied, what are the edits and revisions needed to make this a useful and accessible tool for country at national and subnational level stakeholders. So we looked for countries and sites that there was a home visiting service or program that was already in existence. They had an interest in efforts being made to strengthen their home visiting or their early childhood workforce services. Obviously, availability, so both on the time frame that we were looking for and the ability to participate in efforts such as stakeholder interviews and consultation calls. And that there was some sort of like inflection point. As I mentioned, there might be some political momentum around strengthening the early childhood workforce, the development or the change from pilot to the scale, and these kinds of momentum and inflection points. And then, of course, a willingness to document and share their experiences, which we're so grateful to the 2 countries and the representatives from Bulgaria and Kenya who are here to do just that. And also, we were identifying countries in partnership with UNICEF, and so we're grateful to their support, who identified we're able to send out the information about the pilot opportunity to their regional offices. And we could really look at a number of countries where this tool might be applicable and piloted. Next slide. Okay. So the process that we followed in each country, as I mentioned, we identified Bulgaria first, and then only recently we conducted the pilot in Kenya. So in each country, the process looked a little bit like this. First, worked with country leads to understand what are their current needs, priorities, as well as planning processes related to the home visiting workforce. So what is the context and what is that inflection point in the country? Is it the development of an annual plan, or is it informing new legislation, or in the advent of scaling opportunity? And then we contracted, excuse me, we contracted a local consultant who was able to provide us with a little bit more background on some of the legal framework and efforts that have been done in country around the home visiting workforce, and connect us as well with other key stakeholders implementing and supporting these key services. And so during that process, the consultant was able to conduct a series of key informant interviews as well as focus group discussions that continued to inform the way in which we shaped and executed the pilot workshop. And then we hosted a 2-day tailored participatory workshop bringing together these range of stakeholders. In each country, that looked like approximately 25, 30 participants. And we really tried to have a range of people represented, from direct frontline home visitors all the way to their supervisors, other health officials, other members of civil society representing UNICEF, implementing partners, and then ministry officials at the national level as well. Next slide, please. Really, and during the workshop, we sought to use the tool to develop this vision of home visiting services across the 7 tool areas. Look at what is the current status and the current implementation of key components of an effective home visiting system. Identify workforce development strengths as well as areas for improvement, and then prioritize next steps to continue to capitalize on the strengths and improve some of the soft spots and really achieve the vision that we had laid out. And then finally, this is an opportunity to stimulate discussion and increase alignment around the workforce development, and understand what are the efforts needed to sustain a quality home visiting service and system. Next slide. And then so this is a little bit of a recap of the workshop process, and just looking at across the 2 days that we had to pilot, what we did on each day and how that process unfolded. So here's a picture from the opportunity in Bulgaria. During day 1, we really started out providing some of the background on the tool, as I've done here, and then looking at asking stakeholders to divide up into groups and look at, for each of the tool areas, develop a vision statement, as I mentioned. So what do they hope to achieve? What does this look like in the next 2 to 3 years? And then reflection grids, and I'll show you that more on the next slide, asking them to depict using the tool and using the measure statements. Ask them to plot what is the current status of implementation. So on the x-axis, that looked like, is it being currently implemented, low, medium, high, or sorry, not yet implemented, in progress, or complete. And then on the vertical axis, and you can go to the next slide too, please. The vertical axis, what is the feasibility? So is this something that would be easy to implement? Is it medium effort, or is it high difficult effort? So this really provided participants with an opportunity to sort of visualize their system, to say, well, I really think this is, we've started to initiate this measure, but it's not yet complete, and it will be continued. It will be sort of difficult to continue to implement this, and engage in discussions around sort of the value of that tool with regards to the system. So here's just a quick snapshot. This is from our workshop in Kenya of what one of these reflection grids look like. These are kind of massive grids, but it's a really fun opportunity for people to engage in discussion and negotiate and bring different perspectives to bear. Again, you're looking at these small group discussions, bringing together people from the frontline home visiting up through the national policymakers. And so you hear about different experiences, and people have their own perspectives and experiences to bring to bear on the discussion and deciding where these measures should be plotted. Next slide, please. And so day 2, people have been breaking off. They've had the opportunity to discuss in depth 2 of the 7 tool areas. But we want to make sure that everybody in attendance at the workshop has an opportunity to hear from that group about the discussions that were had. So we invite participants from those groups up to present what the vision they established was, and then where they plotted their measures. And then this provides an opportunity to then prioritize, okay, well, what are the actual areas that we want to focus on, and get a little bit more concrete in terms of developing next steps or action items. And so we do this asking, again, small groups to identify the ways that they can connect their current status of implementation to the vision. And then finally, in the afternoon, we look to summarize some of the commitments and share back with the participants about how the steps that they've identified will be taken forward to continue to strengthen the workforce efforts.
Thank you, Kavita. Thank you, Kavita, for this inspiring overview. So when Kavita was talking, you were able to hear what we envisaged and what we tried to do. So now let's go to the countries and see what we really did and what is their perspective on the work that we did with the tool. So in advance, wait, can you go back with the slide? In advance, we provided you with some materials for reading, but to stay on the safe side, we would like to have a snapshot of home visiting system in Bulgaria and in Kenya, and I would like to start with Vera. Vera, can you tell us something about Bulgaria? Next slide, please.
Hello to everyone. Yes, it's difficult to say that there is a home visiting system in Bulgaria. At least we had started some years ago piloting of home visiting services in 2 regions of the country. And the models we developed were the model we developed with participation with the Ministry of Health and other key national stakeholders was very much focused on providing support to parents and caregivers of young children and pregnant women, early identification of developmental difficulties and other risks for the children, and early intervention through cooperation with other systems. So the services had an universal access, not universal coverage, but access for the people with different levels of support provided depending on the need. As I said, it's been only in 2 regions of the country, and at present the government is planning to scale up the service to all regions of the country. So this is in general the experience of Bulgaria and the situation with home visiting.
Thank you, Vera. Thank you so much. Elizabeth, your system is different. Can you tell us something about CI County in Kenya? Elizabeth. It seems that we are facing some technical problems, and this is often happening with CI.
Hello?
Oh yeah, she's here.
Are you here?
Yes, we are here.
Okay, thank you.
You make
okay. Sorry for that. I'll talk about Kenya and Siaya. In Kenya, we started implementing home visiting for pregnant women and children under 5 some years back around 2013, especially in Siaya County. So the implementation is done by the county government, and in the county government of Siaya, we have about 2,148 community health volunteers. So our target is majorly pregnant women and children, other than other engagements that they also have. So our home visitors are community health volunteers. These are volunteers who are recruited by their very community members. In each community unit that has a population of about 5,000 persons, we have 10 community health volunteers. So basically the 10 community health volunteers take care of those households within a population of 5,000. Each community health volunteer takes care of 100 households. It's averagely 100, between 80 to 120 households. But the target is pregnant women and children below 5 years. The purpose of doing home visiting for this category of group is because we wanted them, one is to improve the caregiving interaction with the children, and we want that to be done right from conception until age 3. So they have messages that they give to the households, to the caregivers, primary caregivers, and they also do other things like screening for children with poor developmental milestones, like children who are low low birth weight, children who are underweight, children who are stunted, and then they refer them to the health facility. So we have supervisors who are referred to as community health assistants. These are the ones who link the facility and the community. So when a community health volunteer has identified a case, they inform the supervisors and then take them to the facility. So that has been ongoing and it's still going up to now.
Thank you, Elizabeth. So two different systems, different needs, but it seems very similar, strong motivation to participate in the pilot. Vera, can you tell us what was your motivation to join us and to participate in the piloting process?
Well, the main reason was that we were at an important moment of time when the government was developing its project for scaling up the home visiting to the country. So, I mean, the piloting of the tool actually help us take stock of what is already available within the existing pilot models in the regions where they were implemented. See what are the available resources developed in within the pilot project, but also available within the country, and then see the gaps and what could be prioritized not only within the planning of this project, but also beyond it. Because I mean, the government plans were to fund the service, the service during the first 2 years with funds provided by the EU, and then allocate government funding for it. So, and given the fact that we don't have any experience with home visiting before, except some 20 years ago, it was very important just to see what are the critical elements for development of a sustainable service. And the second issue was that just 2 months before the piloting of the tool, we had completed evaluation of the pilot services, independent evaluation, which clearly showed that the issue of human resource development is critical for the success of and sustainability of the home visiting service in the future. So whatever plans were of the government, they should have addressed the issue of human resource development. Just to give a little bit about the context in Bulgaria, the home visiting service, the model employed the qualified nurses and midwives, but Bulgaria, being part of the EU and one of the poorest countries within the EU, actually faces a huge issue of migration of health providers, especially nurses and midwives, to other EU countries. So the human resource issue is critical for the whole system at the moment, and we needed kind of think of through a more systemic approach for the future if we wanted to have a sustainable home visiting service.
Thank you, Vera, for reminding us why we are focusing on the quality of the workforce and why we are focusing on providing support to the workforce. And Elizabeth, we know that in Kenya, in Siaya, you have a saying, Siaya, see higher. Meaning that in your county, you always want to be the best, to learn more and to do more. So tell us, please, what motivated you to join us?
Yes, thank you. What motivated us to join is the first time that we interacted with the tool. It came at a time when, like I've said earlier, for the last 5 years, we've been implementing home visiting for nurturing, for pregnant women and children below 3 years. But although we've done a lot and the county has really invested in home visiting and especially in the workforce, we've not had an opportunity to assess the situation so that we get to understand whether there are gaps that we need to strengthen or whether there are issues that needs to be addressed by the government. It came at a time, again, we interacted with the tool at a time that we are struggling to see how best we could motivate our home visiting workforce. The reason being that the county is at the moment scaling up universal health coverage, and we prioritize community health services as being very key. Yet we have a workforce that we had not had an opportunity to know how best we could motivate them and what are some of the experiences that they are having that could be compromising the services, the quality of services they give to the households, to the caregivers. So when we got an opportunity to interact with the tool at the initial stages, we did not want to miss the opportunity. I think we just grabbed the opportunity because we knew it was going to make a difference. And especially, we are also in the process of completing our community health services bill and our reproductive, maternal, and newborn and child health bill. So for us, this was a real opportunity to tap on so that we identify areas to strengthen and also to incorporate as priority interventions in the bill that we are working on.
Thank you so much. Thank you so much for sharing this. I pressed camera by accident. I apologize. Thank you, Elizabeth, so much. And I believe at this point that our audience would like to learn more about what were the main takeaways from the piloting workshops. What were the main achievements of using the tool? And I would like to start again with Vera. Vera, sorry, you are the first pilot. You have to answer first. Can you tell us something about the main takeaways?
Yes, first, the workshop was actually a very good exercise because it involved front-wide home visitors with representatives of the national national and regional health authorities over the discussion of the future development of home visiting. So it's kind of supported this exchange of transfer of knowledge, expertise from the field to the policy making. I think for me also the big takeaway was it somehow encouraged also the government to have a system thinking when they approach the issue of scale up of home visiting, and particularly its resourcing with qualified human resources. We somehow saw that there are many systemic issues that need to be addressed. We also were able through the workshop to identify what is available, what resources we have at national level, to see also the gaps, and it helped also prioritize, because it was clear that some of the issues could not be addressed in the next couple of years, but maybe require, because they are part of some wider systemic issues. As I mentioned, the issue of shortage of healthcare professionals, which is related also to the pay in the system, migration. So it helped kind of structure the thinking, and some of the outcomes, actually, some of the things we discussed and identified during the workshop were taken into the consideration when the Ministry of Health developed the project for scale up of the home visiting, especially related to the review of standards, methodology, curriculum for working with families, tools, and things like this. But other issues were identified that would need to be addressed in the next couple of years in a more systematic way. Just maybe some, just a little, the challenge we faced in our case was that it was difficult for some issues to project in the future, because some decisions has not been taken at that time at the government related to the setup of the home visiting service. But I think the workshop also contributed to this. And the other issue is more like this lack of system thinking in sometimes is a little bit challenge because it requires more comprehensive action than expected.
Thank you, Vera. Thank you, Vera, so much. You are making good points you're building the case for this tool. It's very difficult to see the whole system. We like to focus on specific parts. So, Elizabeth, what can you tell us about what were your takeaways?
Yes, what we can say is one, with regards to the workforce expectation, we identified, first we did our SWOT analysis, that's identifying our strengths and our weaknesses and the opportunities available. And under the workforce expectation, we realized that it's important that the roles are clearly defined. So we identified weakness that was not clear to our workforce, and we needed to address that. The second thing we thought was creating an enabling environment, and that should be sustainable in the sense that during the time that we engage with the tool, we realized that we do not have strong policies that support workforce, the home visiting workforce. And that is an area that we thought we needed to address. Then as a team, we also, identified that this home visit, the design of the tool was very good and very unique and actually very easy to understand and to use. So what we came out with was an in-depth of understanding of our home visiting situation in Siaya, something that is too important, but at least it's an area that we had not put a lot of emphasis on. So as a county and as a team that participated, we got to understand deeply the situation of home visiting in our county. And having that understanding, we were able to identify gaps within the systems and gap within the workforce that we could use to improve the whole health system. And we thought that we also needed to review our curriculum and the scope of home visiting, because it emerged during that assessment that the home visitors were overwhelmed because they did not have clearly defined roles, and also there were no clear systems in place to do mentorship and to do support supervision. So I want to say that we were able to identify those interventions that we can do immediately with minimal resources, those that we can take some time to incorporate, and those that are long-term. And these interventions, we have categorized them that what can we do at what level, right from the community, the sub-county, the county, and up to the national government. So I think those were some of the achievements that we got after engaging with this tool.
You have one more slide with main takeaways. Can you put it? Yeah.
Yes. Yeah. Again, one other thing that we want to say is that we realize that the tool is helping us to address issues with regards to it. It was very participatory, and also we were able to reflect and contribute openly with the experiences and suggestions. One other thing that I cannot miss to say is the methodology of delivery of the tool. It did not only help us to do the home visiting assessment for our county, but we learned a lot of lessons that we are going to use in the future engagement with any particular workforce. And that we think is an achievement, as my county today is already thinking of how do we engage the workforce for frontline health workers. These are the nurses and the clinicians. And again, do a similar assessment and identify ways that we can use to motivate them and to strengthen that workforce. Because for Kenya today, it does not take 3 months before we get industrial arrest. It is strikes, strikes, strikes. But this tool is going to help us to go through that, and also to help us to support home visitors to achieve the intended objectives, and also for the county to realize their objectives.
Thank you. You are moving us to my next question. And that's the question, when the trainings, meetings, workshops are finished, there is always this big question. What are we going to do with the lessons learned? is everything finished with the last day of the workshop, or something is coming, something will happen based on what we have learned? So Vera, can you tell us, is there something, what are the implications for the future in your case?
Yes, I already mentioned some of the things, but actually the workshop, I saw it only just the beginning of a long discussion that we need to take and have over the next years when the country is developing its home visiting system. As also Elizabeth mentioned, at the end of the workshop, we identified some things that we can easily address within the government project and in a very near future. But we also identified issues that need to be addressed as part of a more comprehensive and longer-term plan for especially focusing on human resource development for the needs of the home visiting services. I think for us it was also very important to that the government was with us, and the members also of some government structures to see that it's I mean, the key for the success of the home visitings are the human resources, and this is where the big investment and attention should be given. But as I mentioned, some of the things we identified unfortunately require cannot be addressed unless there is a kind of also comprehensive reform in our healthcare system. So, but anyway, the people could see that it's not just about the issue home visiting. Developing a national home visiting system is not just about taking a couple of nurses and putting them to work on this task, but requires many comprehensive actions related to building their capacity, their retention, motivation, also pay, and everything related to having a qualified, keeping a qualified human resource workforce.
Thank you, Vera, and we admire your dedication and decision not to give up, and we hope that you can use a lot of things that you discovered and defined during the pilot to fight for your case, build your case. And Elizabeth, you already mentioned that you started to do immediately something, so can you tell us more about that?
Yes, Rika, I'm telling you, the tool came in very handy and very timely. Immediately after the workshop, we had to give feedback, myself and my director, to the health management team. And to our surprise, the moment we shared some of the areas that we thought we needed to work on, it was the reception was very good, and the team just saw that at least we were seeing light at the end of the tunnel, because we were left we've always asked ourselves, our home visiting and we've been doing home visiting for a period of time, but despite that, our health indicators had not changed much. So we've been wondering, with all this investment, how come we are not realizing the outcome that we expect? So when we shared the feedback, especially with regard to issues of monitoring and quality assurance, I think very fast the team agreed that we have to call the sub-county health teams and sensitize them on this. And that we did the date on 8th and 9th. And having done that, we have moved to the next level, that during the visiting, we realized that there were issues of the tools that we were using for support supervision. So we're already working on an integrated tool that we want to use both at the community and at the facility. The reason being that I mean, that the exercise we did gave us an opportunity to realize that it's important to integrate these components of nurturing care into the already existing tool. Now, most interestingly, I attended a global health practitioners conference last week in Nairobi, and the theme was community health, link, leverage, and learn. And Zorita, I can tell you that I really took the advantage to share whatever experience we got from the needs assessment. And at some point, I thought that I was giving people new information that initially I did not have until the time that we did the assessment and were able to identify issues with the workforce, expectation, issues of curriculum and all that. And I thought this tool will help so many counties, not only not only Kenya and Bulgaria, but we just need an opportunity to share it even more. Because for us, it's really exciting and it's something that we are moving on with. Next week, we are even having a similar engagement that we had with the community health assistants only, because they have also been complaining that they are ignored, their issues are not addressed. So we want to bring them together so that we do an assessment and identify the gaps.
Thank you, Elizabeth. And again, you opened the next question that I have. And my next question is, would you recommend these tools to other countries or your colleagues, and what kind of advice you would give to them? So Vera, what would be your answer?
I would definitely recommend the
Next
tool.
slide, please. Thank you.
Yes, I would definitely recommend the tool because I think it provides an excellent framework for discussion and reflection for the purposes of situational analysis of the current state of the home visiting service and the human resources involved in provision of home visits. It really covers all aspects related to human resource development, because as I mentioned, sometimes we think this is human resources, only the issues of pay, remuneration, job description are actually the issues related to human resources. But the tool provides a very comprehensive framework touching on many other issues which go beyond. I mean, they also touch on the issue of quality of the services, which is also important. I think it could be also used at both the level of a service provider, of course, with I mean, not some of the issues may not be so relevant, but at least it could be used for own reflection of the services. And also at the national or at the regional level. I also think that the tool could be used for not only for human resources related to home visiting, but I think with adaptation, it's relevant to all issues related to human resources is many other systems like social workforce. It could be other health professionals as well. I mean, it's really very relevant. Of course, it should be adapted a little bit to the situation. So I personally think that it's worth going through this exercise, and it gives you a lot of insight into the service, into the needs of the people, and helps you also plan and prioritize for the future. I mean, for us, the challenge was a little bit, but of course, it's not a challenge. It's also a kind of the part of the needs assessment process is that we had the services in 2 regions of the country, but there were many important elements related to development of a national systems were still missing, like supportive legislative framework, interinstitutional, I mean, mechanisms for interinstitutional cooperation between with other sectors. But I think in any way, this also provided guidance for what we should focus in terms of building a national home visiting system.
Well, thank you for pointing out that it's also important. It's not only about assessing the system, what we have and what we would like to have, but also to map and plot the gaps and see what we can do on our own and for what we need additional help. And what would be your answer to my question, Elizabeth? Besides talking with people at the conferences, what else would be your recommendations?
Yeah, the other recommendation I think that we have is that we, like for Sierra County, having gone through the analysis of our strengths, weaknesses, and opportunities, we have now moved a step further, like I've said, that we want to use the prioritized areas to first incorporate in our annual work plans, and then see how some will get into the already existing policies that we have, and even the ones that we are planning to complete. And this tool particularly, as I've said, it's really going to help us move on to the next level, because we are already doing the assessment now for the community health assistance, and we are already tasking a group to work on the integration of the tool for it's also going to help us to ensure that we address those issues that were emerging during the time that we were doing the needs assessment.
It seems that we have some kind of problems again. Elizabeth?
You hearing me?
Yeah, we hear you now.
Hello?
We hear you.
Oh, I don't know. Where did you last hear me? Okay, what I was saying, that the beauty of this tool is that, one, you can contextualize it to address your needs. Like, for example, you can decide to do a particular module and do another one later. For example, if the problem is workforce expectation, and I want to give an example of these strikes that we have every now and again, we could just use the module of workforce expectation and identify the needs based on that, while withhold the other 6 modules to use another time. Again, one other beauty with this tool is that the people who are affected, that is the home visitors or the workforce that is affected, is engaged in itself to participate, to identify, together with the management, together with the supervisors, bringing all the categories of people together to identify collectively a decision that then moving forward it becomes easier because it's owned by all the stakeholders. Yes.
I think that this is something, thank you for stressing this, and I also think that Vera stressed that this was a unique opportunity to create a safe space for people representing different professions, but also different levels of the system, putting them together and providing space for them to discuss and to build a shared understanding about the issues that are concerning the workforce. And I think that it's also very, very important that both of you stressed that sometimes when we think about systemic issues, we are just forgetting who is in the heart of the system, and that's the workforce, and that it's very important that we take care of them. And now we are moving to our part with questions from the audience, and I think that we managed to address a lot of questions that we collected, but one of the questions was referring to that. Do we take care about workforce? Are they overwhelmed? How can we support frontline workers? Are they confused? Are they able to deliver messages? So I think you all touched that topic, but maybe you would like to stress something. This is a question from Thailand, from our colleague from UNICEF from Thailand. Who wants to answer?
Okay, I want to.
Okay, first Elizabeth and then Vera.
Yes, in response to that, what I can say is that, like for Kenya and more specifically Siaya, I would say that, of course, we realized that the frontline, those is the home visitors, were overwhelmed. And why do we say they are overwhelmed? Because one is that for CIA, all the sectors other than health sector utilize this workforce to engage communities, because they are the ones at the grassroots level, they are the ones in touch with the households. So you find that if a sector like education wants something from the household, an information, or they want to pass some messages to the household, they would use community health volunteers. When an agricultural department wants to deliver their information to the household, they use the same vehicle, that is the community health volunteers. So in a way, as Sierra County, they are overwhelmed. But again, we have realized that despite the fact that they are overwhelmed, there are those incentives that they are getting that are also boosting their morale. For example, in our county today, they get incentives, monthly incentives in form of cash. They were also given incentives in form of money, to seed money for to start income generating activities. And for all of them, we are also paying them the national insurance so that they access services. A time when people are having agriculture, we are preparing our gardens, they are also given a waiver with the tractors given for them at a half price. So there are many incentives that come alongside there with them to motivate them. However, somehow they are still overwhelmed.
Yeah, because being overwhelmed is not only because we could learn both in Bulgaria and in Kenya. It's not only about working conditions, it's about situations that they have to face and families they have to cater. So Vera, would you like to add something, or I can go to a next question?
Just to add something, I think the human resources are key to success of any home visiting service and to achieving the results we expect from the service. This is I think the most critical element, and it's not only about the competencies of the work of the human resources, their skills to work effectively with families, but also their well-being. And I think it's very critical to, when we talk, they are really overwhelmed, because in Bulgaria, for example, in the pilot regions, they deal with 300 families, one home visitor, but also they need support to kind of deal with the stress, difficult situation. And this is something not, at least in my country, not available for any healthcare professional. It's not considered even an important thing. So I really think that the tool also helps kind of see the wide scope of needs we need to consider when we talk about human resources and home visiting.
Yeah, that was present both in Kenya and in Bulgaria, that people, when they were looking at the tool, at Kavita, you can add also if you want, they became aware how little attention is paid to safety, security, and well-being, psychological and physical well-being of the workers. So that popped up, and it was very, very present in both pilots. Kavita, do you want to add something?
Sure. No, just to follow on all of those points, I think they're obviously being overwhelmed takes a number of forms and results from a number of different issues. I think the opportunity to use these community health workers is wonderful, but they do get pulled in multiple directions. And oftentimes, they started as community health workers, so they're also managing topics of malaria, HIV, DOTS, in addition to being expected to provide these more relationship-based services for nurturing care. And so that's a challenge, as well as both participants mentioned the sort of caseload and management issues and the opportunities that they have to sort of have either reflective supervision or to express some of their concerns and at times the stress and the different situations that they can encounter by by entering homes and entering into the relationships that so many families and the challenges that many families face and are working through. So I think, there are a lot of different features to being overwhelmed, and I think the tool really does help put some of those into context and offer the opportunity to have deeper discussions around those areas.
Yeah, it helps people name the problem and then they start working on the problem. We have a question. Elizabeth mentioned very explicitly, but also Vera mentioned that in her presentation, while providing us with her answers, that the tool can be adapted and contextualized to be used for assessment of needs of any workforce in any sector. Do you think it's possible? Can you give do you have example? What are you doing? Did you try to do it?
Yes, maybe I can start to respond by saying that I think as we have said, this tool is not just focusing on home visitors for pregnant women and children. It's any kind of workforce. I think when we went through the tool in SIAYA, we realized that we could adopt it to use it for nurses and clinicians. Not even that alone, you can even use it in any other setup, agriculture, social services, and it's just domesticating it to suit to your situation.
Thank you.
Thanks.
Anybody else?
Yeah, I'll jump in here again. Sorry, this is Kavita. I think that is one of the exciting things about the tool. We do see it as having established a framework for reflection and diagnosing some of the strengths as well as weaknesses. But I do think we are excited about the potential of using the tool for other sectors and services. And just to the points that have been made, I think this is why we do feel like a contextualization phase is important. For the purposes of the pilots, we use the opportunity to work with a local consultant to better understand what are the systems, and particularly, I think this is important going forward, what are the terms that are used within that system? What has to be sort of replaced? How are supervisors defined in the tool and in the context in which you're working with? And being clear about, are we using this as to reflect on the overall community health volunteer service, or are we looking specifically at, in Kenya's example again, the nurturing care embedded within the broader community health volunteer role? And so I think there's sort of those two levels of contextualizing it. I think, making sure the terms and how you've adapted some of the questions and everything is really relevant and clear for your context, and then the opportunity to contextualize it further to other sectors and services as well.
Thank you, Kavita. And I would like to remind you that all of you who were listening, that our panelists mentioned that we used to work in mixed groups. So we had social workers, we had education, early childhood education representatives and health sector. And during the process, they were all reflecting what they would change, and basically it's about more or less about reflection questions. The big areas are more or less similar for each profession. So this is something that we are planning to work on in the future under Early Childhood Workforce Initiative. And we also have a question, I apologize, costs for implementation. We still don't have them, but we are planning to make some kind of estimation. Kavita, can you say something about that?
Not concretely. No, I think what you've pointed out, I think obviously these were two sort of pilot experiences as we sought to further develop and finalize the tool. And so some of our costs might look different than in the future, a country taking the tool on its own and seeking to implement it. So I think cost might be quite variable. I think we would be happy to get into further conversations. And I think from our side, we will try and put some ballpark ideas around that, but we have not done that as of yet.
Thank you. And we have a question for Elizabeth. Is there any chance to do something about professionalization of community health volunteers, that they become like home visiting profession and volunteers?
Okay, I think we are in the process of having deeper discussion into this, because what again we realize that our community health volunteer do not have clear pathway for progression. So, and this is based on the fact that the way we recruit them, I think that it does not give them an opening for further progression. For example, for Kenya, the recruitment is done by the communities, and the criteria is such that you have lived in the community and you are able to read and write. There is no academic qualification, just able to read and write. Then that again limits them, because now if we open a pathway for progression, then that would require that you have a minimum basic education qualification, and probably have some competencies in the area that you want to be engaged with. As at now, we just recruit anybody as long as the community feels that you can serve them, regardless of whether you completed the basic education or not, and as long as you can, they have confidence in you. And I think that is a bit limiting.
Yeah, and if I can add, now I'm switching from role to role. As I remember, it was also mentioned that this is something that popped up during the workshop, and that there is the people are thinking about that, but there must be transition between the position of volunteers as it is now and the future profession, because if you move directly to a new role and, as you said, different requirements, you're going to lose people that you have, and they are the key connection with communities. Yes?
Yeah, sorry.
We have time.
Hold on that
for
1 second.
maybe...
Sorry, Zarza. Just to quickly,
Sorry.
just to quickly build on that point, I think we did have really interesting discussions in Kenya around this, both, as you mentioned, sort of the current opportunities or the limited opportunities for any sort of progression or growth. And I think there was also definitely interest in providing certificates or other ways of recognizing the training that CHVs have received, as a way of laying the groundwork for any future transition or progression, exploring other opportunities, perhaps as making some senior CHVs who can take on some of the other sort of mentoring roles or provide ongoing coaching and support. So those are just some of the kind of other ideas that I think have been discussed in the context of this workshop, and providing opportunities for career progression while still working within the framework of the system.
And I think that's the added value of the tool, because during discussion this question popped up, and then people started to think about different approaches and different ideas how to address the issue. Something that Elizabeth and Kavita were mentioning. And we have time for one more or two more questions. But I think what we have on the list, we already, yes, the tool can be used by government, but it should be, do you have advice if the government wants to use the tool, what they should do, whom they should involve, with whom they should partner?
I take it this is a general question for me. Is this as Kavita?
It can be for you, it can be for Elizabeth, for Vera.
Yeah, I'll just briefly say, I think the objective of what we were defining is that this can be used by government, by different sectors. Whoever, the idea in developing it was that the lead, whoever is leading on some of these services would take the lead in bringing these together. But we really do encourage that that it is a mixed group of stakeholders who participate in this process, that do bring together representation from the other sectors and ministries, as well as civil society. And I think this could be used at sort of the national, county, regional levels. And so those are some of the ideas I think that I would bring in terms of who should be using this within government.
Vera, Elizabeth, do you want to add something?
Well, I'm not quite sure if I can answer the question but it could be used by the government. I think even generally speaking, for me, the best place to use the tool is the government. So yes, this is from my side.
For me, I want to say that it's not that it could be used. I can say that we are already using it, and we are a government in Siaya. So it's a tool that should be used by the government, and that has already started for Siaya County, and also government in collaboration with the implementing partners in the county. So we have to engage our partners also. The same way we did the assessment, we included everybody. We brought the civil society organization, community representatives, management, and all that. At any point that you introduce this tool, you need all the people to be in the same bus so that you work together towards a common cause.
Thank you, Elizabeth. And there is only one more question. Is there a sample of great home visiting manual? We don't have a great home visiting manual, but we will share with you the link for supporting families, for nurturing care, resource modules that were developed by ISRA and UNICEF. And hopefully you're going to use it to support your workforce. Any comment from my panelists, and we say goodbye? Do you want to say something more before we say goodbye?
We'll defer first to Elizabeth or Vera.
Elizabeth, Vera, do you want to say something before I close? And we continue to chat.
Yes, I think what I want to say is that this tool is user-friendly and has come at a time that most people doing home visiting should engage with it and see how they can. Before like Siaya County, before we did this home visiting needs assessment workshop, we could not estimate the magnitude of what was going to come out of that workshop, but by end of day one, everybody was already excited. So I would encourage those people who are listening, who are still not very versed with the tool, to just try it out and see how it works, because it works better than anybody would expect. Thank you.
Thank you. Vera?
Just to ask the thing, I was thinking a lot when it gives you most benefit to use this tool, and I really think that if you plan to start home visiting services in the near piloting or kind of expansion, this is the right time to use the tool for planning purposes and to know, because it will provide you a kind of a roadmap of what you have to do in order to invest really in people who deliver the services. But it's also a good tool for reflection, and do it at even if you have a mature home visiting service, to use it for reflection and improvement. And it could be a part of any quality kind of assurance mechanism, just to check where you are on the way, and then plan steps to address if there are any gaps.
Thank you, Vera. And Kavita?
Sure, thank you. And just again, our thanks goes out to Vera and the wonderful group in Bulgaria, and Elizabeth and the wonderful group of participants and supporters in Kenya as well. I would say sort of my general reflections, I think home visitors and just generally the workforce is such a core component, and I think Vera has said it very nicely over the course of this workshop, this webinar. There's such a core feature of ensuring quality and sustainability of your services, and I think the tool provides such a nice opportunity to have a deep dive and look at what that workforce needs to be supported and strengthened and to deliver on their mandate in a way that brings together different roles and perspectives that can really build a shared vision and sort of a common framework for understanding and a way forward. I think some of the assets of the tool as developed is that you can take it sort of apart and use the modules, use the tool areas individually. If you wanted to take a deep dive, in the instance of Bulgaria, we focused, given the state of the services, we focused a little bit more on sort of those yellow direct areas, so things like workforce conditions and expectations and curricula and training. Whereas in Kenya, given the state of their system and having implemented services for 5 years, we were able to focus more on all of the different ones, and things like enabling environment and monitoring and quality assurance really came to the fore. So provide the opportunity to sort of take out these slices, these tool areas. I think it really does encourage people to reflect on the fact that you can't address one in isolation. And this came out in many of the conversations, particularly in Kenya. We start talking about workforce expectations and suddenly you're engaged in a discussion around what is the enabling environment or on the training side of things. So I think it really does help people to better understand the system element and that these are all important and sort of semi-distinct areas of the system that have implications overall. And then I think one other interesting reflection, I think, is that it's really a benefit to bring all of the sectors and all of the different roles and sort of aligned professions together to develop this sort of shared vision. What could also be interesting is using this only with a set of community health visitors or only with a set of patronage nurses and then only with a set of their supervisors, and use that as an opportunity then to have a deeper dive and then bring together sort of the findings and use that as an opportunity to engage in discussion across roles. In terms of the frequency and use of the tool, again, I think that's up to the needs of the entity that is implementing it. I think there are ways of using this as an annual check, as using it more sporadically to help with different phases of your services, as Vera has mentioned, in sort of early planning stages, as well as opportunities for reflection or ongoing needs. And I think, again, just to kind of end, I think this really does help build overall ownership. And I thought we were really excited by both of these pilots, the opportunity to bring together these different stakeholders and really come together and say, okay, across all of our roles and our responsibilities, what is needed to support and sustain these services and make sure that we can provide the components that are needed for the workforce to deliver the services and the outcomes for the families that we provide, because we all have a vested interest in that. So those are my reflections.
Thank you, Kavita, for this passionate speech at the end. And I would like to say thank you. Can you go to the next slide? I would like to say thank you to my panelists, and I would also like to say thank you to all participants. And I would like to remind all of us that we are also members of early childhood workforce. And let's stay in touch, sign up for our newsletter, and we will share in the coming days link to this webinar recording via email, and we will send emails to all of you who registered for the webinar. And you can find us also on Facebook and Twitter. You can visit our website And if you have any, next slide, please. If you have any additional questions, comments, if you want to continue this discussion outside of the webinar, please write to me. Thank you, everybody. It was a real pleasure.
Thank you too. Bye-bye.
Thank you.
Thank you.
Bye.
Bye. Thank you.
Bye.